Who would have guessed that memory lapses or behavioral changes could be more than just signs of aging? Unfortunately, many people miss the early signs of dementia, leading to late diagnoses and reducing the chances of effective treatment. But what if you could identify these signs early on? In this video, we'll show you 10 early signs of dementia that few people know about. Recognizing them early could make all the difference in quality of life and effectiveness of care. How do you know if it's simple forgetfulness or something more serious? What changes really deserve your attention? And most importantly, what can you do today to prevent or delay the progression of dementia? Stay with us to discover the answers to these key questions. Before we get started, don't forget to like this video, subscribe to the channel, and turn on the notification bell to make sure you don't miss out on important content like this. And tell us in the comments, what part of the world are you from? We'd love to learn more about you. Dementia is not a single disease, but rather a set of symptoms that affect memory, reasoning, and behavior caused by damage to brain cells. These symptoms can significantly compromise the ability to perform daily activities. The most common types include Alzheimer's disease, which affects memory and behavior, vascular dementia caused by circulatory problems, Lewy body dementia characterized by hallucinations, and frontotemporal dementia, affecting personality and behavior, more common in young people. Understanding these variations is crucial for seeking the right treatment and improving the lives of patients and their families. So, let's look at the 10 early signs of dementia that few people know. 1. Memory loss. Problems with recent memory can be one of the first signs of dementia. The person begins to forget conversations that just happened or can't remember where they placed frequently used objects. It's common for the individual to ask the same questions repeatedly or forget important appointments, which can create frustration both for them and their family members. When these memory lapses begin to interfere with daily activities, it's essential to seek medical help for a proper evaluation, as earlier diagnosis leads to better treatment possibilities. 2. Difficulty with words. Who hasn't experienced that moment when the right word just won't come to mind? This is normal. However, when difficulty finding words becomes frequent and compromises the ability to clearly, it might be an early sign of dementia. Signs such as replacing words with incorrect terms, having trouble naming simple objects, or even avoiding conversations for fear of making mistakes are concerning. Communication is essential for social interaction and quality of life, so if you notice something like this, it's important to seek medical help. 3. Lack of motivation. Loss of interest in previously enjoyable activities can be an early sign of dementia that often goes unnoticed. Apathy manifests as a lack of motivation to leave the house, meet friends, or engage in hobbies that once brought joy. The person may prefer to stay at home without apparent reason or show disinterest in social situations. Although this behavior is frequently confused with depression, its persistence may indicate deeper changes in brain function. Being aware of these signs and seeking help is crucial to provide the necessary support. 4. Frequent falls. Do you often trip over your own feet? We all fall from time to time, but frequent falls can be an early sign of Alzheimer's disease, according to research. A study published in 2021 in Frontiers and Neuroscience revealed that older adults who later develop Alzheimer's have a higher risk of falls and other accidents in the years preceding diagnosis compared to those who don't have the disease. It's important to pay attention to these changes and seek medical evaluation to identify any underlying cognitive condition early. 5. Disorientation in familiar places. Getting lost in previously familiar places is one of the most common and alarming signs of early-stage dementia. The person may forget how to get to usual destinations, such as the grocery store or a friend's house. This disorientation goes beyond simple forgetfulness and may indicate that the brain's navigation ability is compromised. If this happens frequently, it's essential to seek medical help, as disorientation in familiar environments can put the person at risk and indicate a decline in cognitive functions. 6. Sleep disorders. Sleep problems such as insomnia or excessive drowsiness can be early signs of dementia. Many people with cognitive decline experience changes in sleep patterns, such as waking up repeatedly during the night or difficulty falling asleep. Additionally, some types of dementia, like Lewy body dementia, are associated with abnormal sleep behaviors, such as sudden movements or talking while sleeping. These disturbances not only affect quality of life, but can also worsen other cognitive symptoms. Addressing these changes with attention and seeking medical evaluation can be crucial for improving the person's overall health. 7. Stooped posture and difficulty walking. Physical changes such as stooped posture and difficulty walking can be warning signs of dementia. Dementia can affect motor coordination and balance, resulting in a slower gait or difficulty maintaining an upright position. Often, these symptoms are confused with orthopedic problems or attributed to aging. However, when combined with other cognitive signs, they may indicate brain decline. Observing these physical changes and seeking medical evaluation is essential to identify the condition early and pursue appropriate interventions. 8. Simple tasks become challenging. Routine activities that were previously performed automatically may begin to seem complex. Difficulty in preparing a simple meal, paying a bill, or following a basic recipe can be an early sign of dementia. The person may feel confused or overwhelmed by steps they previously carried out effortlessly. These signs indicate that the brain is having trouble processing information and executing simple actions. It's crucial not to ignore these changes and to seek professional help. Before we continue, I've got some exciting news to share. If you want to get more engaged, I'm excited to inform you that we now offer channel membership. As a member, you'll pay a small monthly fee and unlock some amazing perks like early access to new videos, priority replies to your comments, members-only shorts, polls, quizzes, and special emojis and loyalty badges just for you. It's a fantastic way to support the channel and connect with us even more. Just click the join button and let's make this experience even better together. Number 9. Loss of interest in conversation. Apathy and lack of interest in social interactions are subtle but significant indicators of dementia. The person may avoid conversations, participate less in family gatherings, or prefer to remain silent in groups. This behavior might be confused with shyness or fatigue, but when persistent, it points to difficulties in the brain's ability to keep up with social interactions. Maintaining active communication and seeking medical help can improve the patient's quality of life and well-being. 10. Fixed gaze with reduced eye movement. Some studies show that in people with cognitive decline, the non-vascularized area in the center of the retina expands, which may indicate the presence of neurodegenerative disease. Research published in 2018 in JAMA Ophthalmology suggested that this increase in the retina's dead area can be observed during eye doctor visits up to 17 years before Alzheimer's symptoms appear. 2 other signs of cognitive decline related to more severe cases of the disease are the loss of depth perception ability, which would explain patients' disorientation, and a constant vacant stare, showing an absence of concentration and ability to interact with what is being seen. How to prevent dementia. Protecting your brain from dementia is within your reach through simple and effective habits that can transform your mental health. Scientific research shows that combining regular physical exercise, even just 30 minutes of daily walking with a Mediterranean diet rich in fish, olive oil, vegetables, and whole grains, can significantly reduce the risk of developing neurodegenerative diseases. Keeping your mind active is equally crucial, and this can be achieved through enjoyable activities such as strategy games, reading, dancing, or learning a new language. Regular socialization with friends and family also plays a fundamental role, creating new brain connections and keeping cognition sharp. Additionally, ensuring quality sleep, around 7 hours per night, allows your brain to perform its natural toxin cleansing process. To complete this brain protection, it is essential to quit harmful habits such as smoking and excessive alcohol consumption, while keeping blood pressure, cholesterol, and blood sugar levels under control. Preventive care such as regular vision and hearing checkups, protecting yourself against head injuries, and managing stress through relaxation techniques forms a comprehensive protective shield for your brain, ensuring a healthy mind for longer. Do you have any of these early signs of dementia? Leave your comment below. If you found this video helpful, please type yes in the comments below. I also encourage you to check out these 2 videos we selected especially for you. Thanks for watching.